The Cleveland Clinic has released the results of an interesting survey about coping with COVID-19 and the impact on men's health and men's attitudes about health. Dr. Peter Byhick is here today. He's a urologist and a men's health expert, and he's here to talk about the results of that survey. Good morning.
Good morning. Thanks for having me on, Angie.
I'm so interested about the findings. Can you share some of the results of that survey?
Yeah, so this is our 5th annual survey called Mention It, where we're trying to get an idea of men's health behaviors by surveying about 1,000 men from around the country. This year, we wanted to focus on how the COVID-19 pandemic was affecting men's health. And we found a couple interesting things. The first thing we found was that about 77% of men expressed that they had increased stress related to COVID-19. But unfortunately, about 2/3 of men said that they were not likely to talk to anybody about it. About half of men reported that they were delaying care and not going to the doctor for non-COVID-19 related issues. We also found that about half of men felt that their health was worse during COVID. About a quarter said they gained weight. About 15% said that they had increased alcohol use. But we also saw that about half of men said their health was actually better, that they were exercising more, sleeping better, eating better, and spending more time with family.
Well, it's so interesting to have these polar opposites, if you will. So now that you have this data, how will you use it and how will it impact the work that you do?
Well, so the first thing is that I recommend to all men to not delay your health care just because there's a pandemic going on. In a lot of ways, it's even safer to come into the hospital than it is to go to the grocery store. We at Cleveland Clinic are taking a lot of measures to make sure that it's safe for patients to come in. That includes providing personal protective equipment, checking temperatures on everybody coming in, limiting the number of visitors. And we also offer, along with many others, virtual visits or telemedicine, which has definitely been increasing in use since COVID-19 started. So there remains, an option for you to come in to be seen in person or to be seen from the comfort of your own home. And it's also important to keep up with regular screening tests, for example, for prostate cancer, colon cancer, getting your blood pressure and cholesterol checked. These are all still important things that you need to make sure you continue to do.
On the negative side of the survey, of the men who felt were less healthy, maybe gained weight, drank too much, how did that compare to the statistics pre-COVID-19?
Yeah, good question. So the way that question was phrased was specifically as it relates to this time period, and how it was a change from the baseline. One comparison that we did make with this survey was how stressful was this compared to the 2008 recession. And the majority of men, about 59%, actually said that this time period was more stressful than the 2008 recession.
Wow, this is just really just staggering to think about the scope of this. Where can our viewers go to learn more about the survey and your work?
Yeah, so you can go to clevelandclinic.org/mentionit.
Thank you so much for taking the time to be with us today.
Thank you so much for having me on, Angie.
You're welcome. We'll be back with more local lifestyles right after this. Stay with us.